My name is Yasmin Silva. This is my student ID. I'm going to start off by providing patient privacy with the curtains. Hygiene. Hi, my name is Yasmin Silva. I'm your student nurse today, and I'm here to do your head-to-toe assessment. Is that okay?
Yeah, that's perfect.
Okay, so just so we can start off, I just need you to confirm your full name and your date of birth, please.
Yep. Valentina Escobar, December 21st, 2000.
Perfect, thank you. Now I'm going to start my general assessment of the patient. Patient seems to be well rested. Her physical appearance, she seems well kept with her personal hygiene. There's no foul odor present. She seems to be in a good mood. When I ask her questions, she's able to respond them with no slurring of her speech. Can you stand for me?
Mm-hmm.
Perfect, and just sit down. Patient looks like she is the right age that was given, and her height is consistent with her age as well. Her skin color is consistent with her ethnical background, and there's no redness or unusual discoloration. Patient's weight seems to be consistent with her build as well. Okay, one more time, can you just give me your name, where we are, and roughly what time it is?
Yeah, so my name is Valentina Escobar. We're at the hospital and it is 2:19.
Okay, perfect. With this, the patient is alert ×3, and her mood seems well. She's relaxed and at ease. So now we're going to start with the head assessment. So upon looking at the patient's face, her head structure is normal cephalic in size. There is no unusual lesions, scars, masses present around her face. All of her features seem to be symmetrical. Now I'm going to start testing for cranial nerve number 7, which is the facial nerve. Can you close your eyes for me? I'm going to try to apply resistance. You're just going to try to open them. Okay, perfect. Put your eyebrows down. Rise them up. Puff out your cheeks. Smile. Frown. Perfect. Upon this, the patient was able to perform all of the commands, and they were bilaterally equal to both sides of her face. Therefore, cranial nerve number 7 is intact. Now we're going to move on to her eyes. Can you close your eyes for me? Okay, so just inspecting the patient's eyelids. There's no lesions, no scars, no redness or bruising present. Her eyebrows are symmetrical in position, and the distribution of her hairs are evenly. Her eyelashes as well, there's even distribution on both sides of her eyes of her eyelashes. Okay, you can just open up. I'm going to press down. You're just going to tell me if you feel any pain, okay?
No pain.
No pain. Upon inspecting the patient's eyes, her conjunctiva is pinky and it seems moist, and her sclera is white, and there are blood vessels present in both the inners and the outer corners. Now I'm going to test for cranial nerve number 3, which is ocular motor. You're just going to look straight ahead to me, okay?
Mm-hmm.
So both the patient's pupils are round and about 4 millimeters in diameter, and now I'm going to check for the constricting, both direct and consensually. Okay, upon direct light shining, the patient's pupils constrict. And while doing the consensual test, they also constrict. Now you're just going to follow the pen light with your eyes, okay?
Mm-hmm.
When doing the accommodation test, the patient's eyes converges inwards and the pupils both constrict. Therefore, patient's cranial nerve number 3, the ocular motor, is intact. Now we're going to move on to her ears. Upon inspection of the patient's ears, they seem bilaterally equal in position, and there is no visual redness or lumps or masses or lesions or scars on her ears. When looking inside the patient's ears. There's no excess discharge or drainage or cerumen seeping out of her ears. Moving on to her nose. Patient's nose is midline to her face. There is no abnormal flares of her nostrils as she inhales and exhales. There's also no discharge coming out or scars or lesions present on her nose. Moving on to her lips. The patient's lips are symmetrical and proportionate to the rest of her facial structure. Her lips are pinky and they are hydrated. There's no lesions on her lips either. Now I'm going to test for cranial nerve number 9, which is the glossopharyngeal nerve, and cranial nerve number 10, which is the vagus nerve. I'm just gonna put this tongue depressor on your tongue, and I'm gonna have you say "ah" for me, okay?
Okay.
Perfect, thank you. Once doing the test, both her soft palate and the uvula rised up. Therefore, cranial nerve number 9 and 10 are intact. Now you're gonna stick out your tongue for me and just stick out your tongue. Perfect, move it side to side. Thank you, and repeat the words "light, tight, dynamite."
Like tight dynamite.
Thank you. Upon this, cranial nerve number 12, hypoglossal is intact because the patient's tongue was able to maintain midline and she was able to move it side to side, and also repeat the words "light, tight, dynamite" with no noticeable tremors. Now we're gonna move on to the neck. Upon looking at the patient's neck, there's no lesions or masses or scars present. There's no abnormal swelling either. It seems to be midline. The trachea seems to be midline. I'm going to palpate. Just let me know if you feel any pain, okay?
No.
No pain? Okay. There's no obvious enlargement of her thyroid gland, and her trachea is also midline. She felt no tenderness. The skin is warm to touch, and there was no abnormal colors or discolorations present. Now I'm going to assess her carotid arteries. Both sides seem regular rhythm and bilaterally equal, and they're at a 2+ bounding. Okay, now I'm going to assess for cranial nerve number 11, which is the spinal accessory nerve. I'm going to apply resistance to both sides of your face. You're just going to try to resist it, okay?
Mm-hmm.
Perfect. Okay, and now the same thing, just try to shrug your shoulders up. Perfect, thank you. Patient was able to resist force and moving her neck side to side and also shrugging her shoulders up. Therefore, cranial nerve number 11 is intact. Now we're going to move on to her upper extremities, and I'm going to start by inspecting her arms and her hands. Upon looking at her arms, there is even hair distribution on both arms. There is no visible lesions or masses or even joint pains around her elbows, her wrists, and her fingers. There's no discoloration, there's no redness, and the color is cohesive with her ethnical background. I'm going to palpate and you're going to let me know if you feel any pain, okay?
Okay. No pain.
Okay, no pain. There's no tenderness or superficial masses felt upon palpation, and her skin on her arms and her fingers were warm to touch. Now I'm going to assess the patient's radial pulse. Can you just take off your watch for me, please? This I would count for 30 seconds and then multiply it by 2. Okay, perfect. After 30 seconds, the beats per minute is of 80. It's bilaterally equal and it's bounding +2. Now I'm going to do the grip test. Can you just squeeze my hands as tight as you can? Perfect, thank you. Upon completing the grip test, the patient has strong grip of +5 and it's bilaterally equal in both her right and her left hand. Now we're going to inspect her lower extremities. I'm going to push this up. And take off the shoe. Perfect, thank you. Okay, upon inspection of her legs and her feet, there's even hair distribution on both legs. There's no visual lesions, masses, or scars on her legs or any edema present. With her toes, the same thing. They seem to be the same size, and there's no lesions on her toes or any discoloration or bruising. I'm gonna palpate now and you just let me know if you're feeling pain, okay?
No pain.
Okay, patient reports no pain. There was no tenderness felt upon palpation or superficial masses also. Now I'm gonna get you to turn around and take off your shirt so we can do the thorax. Upon inspection of the patient's posterior thorax, there is no visible lesion or masses present, no moisture either. There's no redness or bruising. The color of her entire back is consistent with her ethnical background. The scapula are in the same place and bilaterally equal. There's no skeletal deformities of her spine. Now I'm going to check for her chest expansion. I'm just going to have you take a deep breath in for me and out. Thank you. Upon taking a deep breath in and a deep breath out, her chest expansions is bilaterally equal. Now I'm going to palpate and you're going to let me know if you feel any pain, okay?
Okay. No pain.
Okay, there's no pain. Upon palpation, I didn't feel any tenderness or superficial masses felt either, and her skin is warm to touch. Now I'm going to auscultate the patient's posterior chest. Every time you feel the stethoscope on your skin, can you please just take a deep breath in and out for me?
Yeah.
Perfect, thank you. You can put on your shirt. Upon auscultation of the patient's posterior chest, I heard no wheezing or crackling presence. There were clear breath sounds, bilaterally equal throughout both sides. From T1 to T2, I could hear bronchovestibular sounds, and from T3 to T4, I can hear vestibular sounds. You can just turn around. Now I'm going to inspect the patient's breathing rate. At this moment, she wouldn't know that I was doing this, and I'm also going to assess it for 30 seconds and then times it by 2. So you can just take regular breaths in and out for me, okay? Thank you. Upon assessing for 30 seconds, the patient has 20 breaths per minute. She did it effortlessly. There was no tugging of her trachea while she was breathing, and it didn't seem like she had any excess use of her accessory muscles while breathing, and there was no labored breathing. Now I'm going to assess her cardiovascular system, and I'm going to listen to her apical pulse, which is located in by auscultating the mitral valve, which is located in the 5th intercostal space in the left submidclavicular line. Can you just lift your shirt for me, please? Just gonna lift over to the bell. Perfect, thank you. This would also be listened to for 30 seconds. Her beats per minute are regular in rate. She had 80 beats per minute. I could hear S1 and S2, but there was no presence of S3 and S4, resulting in no sounds of brewery or murmurs present. Now we're going to move on to the abdominal assessment. So can I just get you to lie down on the bed, please? Okay, I'm just going to lift this up. And I'm going to pull this down, okay? Okay, and upon inspection of the patient's abdomen, there is no unusual masses or lesions or scar present. I do see a little bit of striae along her lower quadrants. There's no unusual pulsations either. There's no redness and no discoloration, and the color is consistent with her ethnical background and the rest of her body. Now, if I look at the contour, her contour is flat, and then to assess for the umbilicus, I would look at the edge of the bed, and I'd see that her umbilicus is midline and inverted. Now I'm going to auscultate the patient's bowel sounds using my diaphragm, and I'm going to start at the lower right quadrant, and then the right upper quadrant, and then the left upper quadrant, and the left lower quadrant. Perfect. Upon auscultating the patient's abdomen, I could hear high-pitched gurgling sounds. The frequency is from 5 to 30 gurgles per minute, resulting in hyperactive bowel sounds. And now I'm going to palpate the patient's abdomen. Just let me know if you feel any pain, okay?
No pain.
No pain, okay. Patient report no pain upon palpation. I also didn't feel any distension, and her abdomen feels soft and non-tender. And that concludes my assessment. So I'm just gonna drape the patient. Okay, and you can just sit right back up. And that concludes my assessment.